Hey guys, we got another genetic counselor interview today. This time it's with Liz Sheehan. She has a lot of great insights and she's done a lot of cool things, including some diversity advocacy within the field of genetic counseling. So take a look at this interview. Hope you get a lot out of it.
There you go.
Awesome. Okay, so would you mind just to start off, give a little introduction of yourself and I guess your educational background that got you to where you are now?
Sure. So I'm Liz. I am a prenatal counselor at McGee Women's here in Pittsburgh, and I got my undergraduate degrees at Loyola University in Chicago. I did biology and then Italian. That was just kind of for fun. And then straight from undergrad, I ended up going to Brandeis to get my master's in genetic counseling, and then came here, and I've been working here for the past 3 years.
Awesome. So to go off of that, what is the genetic counseling specialization that you found yourself in? So
So
you said
yeah,
prenatal.
yeah, prenatal. So I mostly see prenatal. I also see preconception patients with our reproductive endocrinology and infertility team. So people going through in vitro fertilization and want to do testing of embryos for a specific reason, finding genetic causes of infertility or recurrent pregnancy loss. And so I also do kind of that arm of prenatal.
So what led you to go into that specific specialization?
I've always been really interested in like obstetrics and just embryology in general. So it's just kind of a natural fit for me. And it was the type of counseling that I felt most comfortable in as a student, and really felt like I got a lot of job satisfaction out of.
That's awesome. So what would a typical day as a counselor look like for you specifically?
So I work 4 10-hour days. So I'm in working for 4 days a week. 3 of those days I'm in the hospital seeing patients both in person and through telemedicine. Usually have about 6 to 7 scheduled patients a day for about an hour or so each. They may not always take the full hour, but they're scheduled for that if we need it. Um, those patients range from there's family histories or personal histories of certain conditions. There's something different on ultrasound or a routine screening test during pregnancy, and they have a concern that maybe baby may be affected with a genetic condition. Other times it's just to discuss testing options during pregnancies. And so we primarily see those types of patients. And then, like I said, some of my RAI patients for infertility causes. Um, and then the other couple of hours of my day, we usually spend charting, dealing with insurance, trying to call out results. And then I work from home 1 day a week, which I'm doing today, mostly seeing telemedicine patients, doing meetings. Um, I work, um, we all at UPMC have adjunct professorship with University of Pittsburgh so that we can teach courses or give lectures to the genetic counseling students there or the med students. So sometimes we'll do lectures on those days. But most of the time, that's kind of like my catch up day to get everything squared away for the days that I'm busy seeing patients.
Okay, great. It's really cool that you get to still work with the current genetic counseling students and kind of teach them some of what you learned. So
Yeah, it was
yeah,
definitely one of the reasons why I came to UPMC. I knew in a job I wanted to work with students. And it was really easy because the Pitt has their own genetic counseling training program or a site for the prenatal rotations. And so we have about two current students with us at any given time from the Pitt program rotating through their prenatal rotations.
okay, awesome. I'm curious, you mentioned how you do some telehealth now.
Mhm.
I'm assuming that if you didn't do that before COVID, you definitely did a lot more of it once COVID happened. So how does that transition go for you, since it's kind of a more personable and sensitive career with these kind of discussions you have?
Yeah, I think it's been great, especially here in Western Pennsylvania, to have so much more access to patients who probably otherwise may not have seen a genetic counselor or may have put off seeing a genetic counselor. there are definitely circumstances where it's still best to see us in person, either for really, really heavy conversations, or a lot of times we see patients following their ultrasounds, or if they're going to get a diagnostic test that day, so they need to be in the hospital anyway. But I feel like for people who have personal or family histories, just kind of getting a risk assessment or want to talk about some of their testing options in their pregnancy, or just even review some screening tests they've had done and maybe go on to further testing. It's been a pretty useful tool. We didn't use it that much before. We had like telemedicine set up at a couple of other hospitals throughout the area. So like a couple of hospitals out in Altoona, Erie, about like Clarion, and the patients would still have to go to that hospital, but at least it wasn't the trek like into Pittsburgh to come see us. Now with the telemedicine that we have through the My UPMC app, people just log on their phone and they can see us and chat with us. So it definitely expands access a lot more, which is really important in genetics. I think not everyone has a tendency to view it as seriously as an in-person consult. So, people may view it just as you're having a casual phone call of kind of walking around their house or out getting groceries, out doing things. So it's harder to assess what their knowledge level is and taking that from you, but it just kind of changes your own skill set of how do you assess some of those things, and different from how you would traditionally do it.
Very nice. Yeah, it seems like it definitely would help. Maybe going forward, they'll keep that around a little more to improve the accessibility and everything.
Oh yeah, I don't think it's going away anytime soon. Too many
Hmm.
people like the telemedicine, so I think that's here to stay with UPMC.
Well, that's great. The next question I had for you is, what would you say is your favorite part of being a genetic counselor?
I really love working with patients and walking through how things impact them. And so I think both my favorite and least favorite parts of the job are with some of the heavy psychosocial considerations that we have with some of our patients, particularly in prenatal. You're kind of blindsiding some people with there's a difference that they really weren't expecting because they're not out in the world. You can't see that they have a difference or they're acting any different ways. All you get is kind of grainy black and white pictures, and until a 20-week ultrasound, you may not know anything's a little different. So kind of going through and walking through that initial shock, and all right, what do you need in this moment from me? We can always have more conversations later, but how can I help you now? And sitting with someone through that is probably the most satisfying part of my job.
That's awesome. And I guess on the contrary, what would you say is the hardest part of being a genetic counselor?
Yes. I think also those conversations, it's both really satisfying, but also really difficult, especially if you're delivering a known diagnosis that really doesn't have a great prognosis with it. So, incidentally diagnosing something like trisomy 18, for example, where yes, care is getting a lot better for these kids, but still most babies with trisomy 18 don't make it to term, or they don't live very long after birth. And certainly not something anyone's expecting to be hearing. It's not a common chromosome difference like Down syndrome is that people have heard of before. So it's always a combination of the shock and awe, but also, well, what is this? What does this mean for us? I've never heard of that before. So they're definitely really hard conversations that come out of that. But again, at the same time, I like being the person that has that conversation with them.
That definitely seems like one of the, it's not a secret that it's going to be some heavy conversations, and that's probably one of the hardest things. I'm curious what you had done, whether it was an undergrad or just through experience, that helped you kind of acclimate yourself to have those conversations and feel more confident about them.
Yeah, I don't think I had done anything specifically, or I wasn't good at doing anything specifically to prepare for that in undergrad. I hadn't quite thought that far ahead yet. I think one of my first experiences with thinking about that was when I was in undergrad and I was shadowing genetic counselors, and I shadowed um, a counselor who was in prenatal who had just given a devastating diagnosis. And I just like, I ran out of the room. I couldn't be there anymore. I was so sad. I was crying, and because the patient was crying, patient's partner is crying, and dad's crying is what gets me. Like, that's what breaks me down. And so I was just like, oh my God, I can't do this. This was a wrong choice. I should go back to being something else. I didn't want to be a doctor, but something else. And then I sat with the counselor and was like, no, like, this is why I wanted to do it. We'll get better at working with these things and kind of disassociating your own feelings towards something to a time where it's more appropriate for you to process them. Definitely don't shove them away, but enough so where you can focus on the patient and then process them later. And I really feel like that came from my genetic counseling training program and Brandeis, where we have pretty intensive psychosocial training there. We have 2 full semesters of kind of psychosocial methods and how to just do that and assess that for someone without any of the science behind it. But it also served, we also had kind of group supervision sessions where we would all check in with each other once a week with a licensed therapist and talk through some of these things. So just starting to establish having that community was really helpful. And it then led me to seek out that community here in Pittsburgh, be able to talk with some of my coworkers about tough cases, and just try to figure out what am I doing for myself outside of work that's going to help me debrief from the day and be able to go back and do it again the next day.
Yeah, thank you. The support system sounds like a really great idea, and especially when you're still in graduate school, like learning to do this for the first time in your rotations and everything.
Yeah.
Yeah, that's great. And the last thing I had specifically to ask you is, what advice would you give yourself, your younger self, when you were applying to grad school and kind of going through that process that you didn't know then, you know now?
That's a really good question. I think probably would be something to do with like leaving perfection at the door. So I was pre-med before deciding that I didn't want to be a doctor, and then switched gears and found genetic counseling. But that like pre-med mentality and just science mentality just like breeds, you need to get straight A's. Anything less isn't okay. You're never going to go anywhere if you don't. And that's pretty far from the case with genetic counseling. You still need, good grades to get into a training program. I think a lot of programs are doing away with the GRE, which is great. But you reread these personal statements and try to think about the things you want to include that would make you appealing to a program. But I mean, I don't know of many other training programs that are as personalized as genetic counseling is. And that's just because it is both a combined academic and a clinical master's degree. It takes everything you have for 2 years of your life and then some. And it's going to be really emotionally and physically draining. But you want to be and end up in a place where it's going to be able to be supportive of you. And so it's not so much of saying the exact right or perfect thing in some of those statements or your interviews. It's about reflecting who you genuinely are and seeing if that program would be a good fit for you or not. Because just getting into a genetic counseling training program to do that may not necessarily, I don't think that's the right end game for someone. Every program is going to train you perfectly well to be able to be a genetic counselor. But they make very deliberate choices of who's in what program based on the interviews and selecting that kind of cohort for the year based on the different strengths that everyone's going to bring and what we can all learn from each other. So as personal of a process as it is, taking rejection is not necessarily a personal offense. And it sucks, it's awful, but you will end up in the right place if genetic counseling is going to be the right field for you. It may not necessarily be that year or that particular program or cohort, but I promise you're going to end up where you're supposed to be.
That's really, really good advice. So you're thinking, not compromising who you really are to try to appeal to the program you might be applying to or interviewing with,
100%.
really letting
Yeah,
it match on its own. That's great advice.
A big topic that's been a long time coming for genetic counseling is areas of diversity and inclusion across all aspects. And so, we historically are pretty female, white, cisgendered, heterosexual. And, a couple of us have been screaming at the doors for years of this needs to change. And it's, essentially become a big reckoning within the past year and a half or so, just like a lot of other places have. So things are changing very quickly to be more adaptive to all other counselors, all other students that we work with. And not everyone's going to get there overnight. Some people won't get there, but there's big strides happening to make those changes, especially with leadership and many program leaderships. And so the best that you can put forward is just who you are as a person and what you can offer to your fellow students, to yourself, to the training program, and to the field in general. Where do you want to take your career? What about this excites you? It doesn't have to be a straightforward clinical role in the big three: prenatal, peds, cancer. There's so many other roles out there for someone to explore. There's always going to be something for you.
That's a really good point. And you reminded me, I was looking on your LinkedIn, I believe, and I saw some of the diversity that you advocate for. For instance, I remember like representing non-binary individuals on a pedigree. I never thought about that myself, but that totally makes sense. And it's really interesting that you're doing that. That's definitely great.
Yeah, that's actually a really good example of ending up at the right program. So Brandeis was not my number one pick. I wanted to go somewhere else, and I was on their wait list and just never made the cut. But Brandeis was pretty high on my list, and they accepted me pretty early out the gate. And it was just a word that the director at the time had said to me that actually made it click that, oh yeah, I actually remember that interview being really different than every other interview I went on. So back in college, I was really involved with like college Democrats and ended up being the president of the organization for a while. And it was, something I was clearly passionate about. It drove a lot of what I wanted to do advocacy wise. And the director saw that on my resume during my interview and asked me, well, what makes me a Democrat? I was like, are we talking about this right now? I didn't think I could talk about this on an interview, but we talked about it. We had a really good conversation about it. And then when she called me, it's like, I think you're going to be really happy here. The Democrats on campus are really active. It's here in Massachusetts. And it was just so personable of even just the acceptance of she remembered that about me, to make me think like, oh, every other place asked me like what I learned from that position. I was president of an organization. What do you think I learned? Like leadership, organization, etc. But, they asked me more of what drove me to it. And that's what was the focus. And that's what I really appreciated. And so it made sense then. You know what? No, this is going to be a good place for me. And one of my professors at Brandeis was teaching us like pedigree nomenclature, and had pointed out that there aren't standard recommendations for transgender and gender nonconforming individuals. And she was really supportive of me kind of rolling with that as my thesis. She was my thesis advisor. We ended up publishing it, which was really great. We did some talks at NSGC that year. So having that supportive environment to kind of break the mold from some of that was really helpful.
That's really great. It's great that you're doing that. And that definitely seems like really good confirmation that the right program will kind of find you if
Right.
you just let it happen.
Right.
That's really
Exactly.
exciting. And one more thing that I just thought of is the notion that, oh, I want to be a genetic counselor because I love science and I love helping people and I kind of want to be in medicine. How accurately do you think that really does fit that description or that kind of common interest and reasoning now that you are a genetic counselor?
I mean, I think all of those things are true. Like generally, yes, you have to want to help people work through what this means for them. It's very science heavy, so probably not best suited for people who don't, enjoy science. I think it takes another level of, there's certainly like a teaching component to it. So if you have background in education, it's actually a really great way to blend all of that, because I think of counseling a lot of times as teaching without grading papers. And it's just more personal teaching. You have to bring your language down to a level that the patient's going to understand. So you're taking really difficult scientific concepts and having to teach it to someone else at like an eighth grade level or less. That requires an extensive amount of knowledge of those concepts, because to explain, it's always harder. Like if you study for a test, I always think the best way to study for a test is to try to teach someone about the content on that test, and then you realize what you don't actually know. And so you not only have to understand those things to an intense degree, but then you have to be able to explain it to someone else who has no background in science at all. There are people who haven't even graduated high school coming to see you. And so I think wanting to share that knowledge with other people is definitely another big component of that. And it kind of takes a step more than just wanting to help people. There's tons of jobs out there of wanting to help people. What is it about genetic counseling that really draws it to you? Is it the level of interaction you have with people? I mean, we have 45 minutes to an hour for most places to sit down and have in-depth conversations with patients. Is it more on the lab side? You like helping ordering providers understand the tests and understand the results, and generating reports and interpreting what those results mean for them. There's lots of different levels to it, but what at its core really makes it different than any other job for you.
Okay, great. Yeah, I really am interested in the teaching component too. That's something I'm very excited about. I thought about being in education to some degree, but I think this is a really good way to kind of combine that. So
Yeah.
that's really great to hear.
Yeah, and like I said, a lot of counselors are involved with teaching other genetic counseling students, depending on where you end up. But there's tons of counselors even in advocacy for like patient advocacy groups, or just teaching other groups about either what genetic counseling is or what genetics as a whole can mean as we grow as a society. I mean, genetics is only going to become more and more prevalent in every part of our healthcare. So, you and anyone else going into genetic counseling is going into a good field. We have pretty good job security.
Yeah, absolutely. There's really impressive statistics about how much it's going to grow in the next couple of years. It's really exciting.
Mhm.
Well, those are honestly all the questions I had for you right now, but I really do appreciate you taking the time and speaking with me today.
Yeah, of course. No problem, Ethan. Happy to help.
All right, thank you. Have a
Bye.
good
Have
day.
a good day.
All right, once again, that was Liz Sheehan. Really great interview, learned a lot, and had a lot of great insights from this particular genetic counselor. Again, appreciate her time speaking with me, and then we will have more of these coming out in the coming days and weeks, so stay posted for those. See you next time.